on the road. And that's a memo. Now for the top story tonight, reaction from two Democratic congressmen. Joining us from Capitol Hill, Brad Sherman from California, and from Baltimore, Joe Sestak from Pennsylvania. All right, Congressman Sestak, being with you, the cost of the bill, does it worry you?
We pay for this. You may disagree how we pay for it, Bill, but it is paid for. It's paid for by raising revenues, and it's paid for by finding savings in Medicare as well as other means. But it is paid for. In fact, Congressional Budget Office says we save $120 billion this decade and much more next decade. And actually, is it going to save you, Bill? Absolutely. If you're in a family of four today, you actually pay $1,100 more for the uninsured than you would if they were covered.
All right. Now
so by covering them over time, you do save even more.
Look, when you say the Congressional Budget Office, that was dealt with today in the Wall Street Journal, Congressman Sherman.
I read it. Yes.
By saying that the Budget Office is only analyzing data given to it. And these are projections. Congressman Sestak says, okay, we're going to cut Medicare and save X amount of dollars. Some people don't believe that. It's unprovable. You can't prove it. So Congressman Sestak is believing what the Democratic Obama line is. Do you believe that down the road, Congressman Sherman? Do you believe all that it's going to be fiscally beneficial for America?
Look, if you're an Indiana Colts fan, you say the referees got it wrong at the Super Bowl and your team really won. The fact is we have one referee. It is CBO. I don't always like them, but they do determine what the best.
But if the data is faulty,
now as to the data being faulty, they get the data. The data is not delivered to them. They start with all the data that they get on their own. As to the risk is if we do nothing. Because right now,
nobody wants to do nothing. Do it like I said, in the private way.
The Republican program does nothing for those with pre-existing conditions, and if you have coverage, your Blue Cross card is shrinking.
Okay, but I don't want to look. I'm not rooting for either party. I'm not rooting for either party here. You got to get that. I'm not saying the Republican plan is better, the Democratic plan is better, but I am saying it is impossible for any human being on this earth to say with certainty that you're going to pull this much money out of Medicare. You don't know. You also don't know the unintended consequences of the Medicare cuts. Doctors could walk away. Health clinics could shut down. Hospitals could say, we don't want to cover Medicare patients anymore. It isn't worth it. You might have to force them to do it. All of these things make
all those
the
things
risk.
Could happen if we
Bill,
don't act.
And Bill, you have to make up your mind. You can keep saying, I don't believe, but the Congress for decades has had one nonpartisan office that actually looks and studies for one factual place we can go, both Republican and Democrat, whether it was the Bush tax cuts or whether it's President Obama's health care plan. That is the one place we go for a nonpartisan opinion.
Well, what the CBO can't do is it can't project income from tax rises. Can't. Because people may leave the country. And number two, it can't project cuts that haven't been made yet. But this disturbs me. You guys are smart guys. I wouldn't have you on the show if you were the Sanchez sisters, with all due respect. Okay? You're smart guys. All right? You know.
Well, I think the Sanchez sisters are very effective members of Congress.
All right, Mr. Chairman. I know you have to say that, but you're from California.
I don't have to say that. I'm saying it because it's true. Go on.
All right, but I wouldn't have them on to discuss this option. I'm having you guys on because you're smart guys. You know Medicare's in trouble. You know Medicaid's in trouble. You know Social Security's in trouble. You know the federal government is not going to be able to meet its obligations on those three fronts. Now you're going to both of you, for another $1 trillion plus entitlement that will probably run into the $2, $3, $4 trillion range. You guys know, and you got to be honest with the folks here, the feds are never going to be able to pay the bill. They can't pay the bill, guys. No matter how much you tax me, you're not going to be able to pay
the deficit by $1 trillion. We need the $1 trillion of deficit reduction this bill will provide. If
and
we
you
fail
know
to
that
adopt
for
this
sure.
bill and we throw away,
you're 100% certain.
It could be too. I don't have 100% assurance that I'm waking up tomorrow, but you got to go with the CBO. I don't have 100% assurance that the Saints won the Super Bowl, but that's what the umpire had to say.
Well, the Saints did win the Super Bowl. We know that as a fact, and we also know that the three entitlements
if you want to say the referees had it wrong, go right ahead.
Now, listen, I'm worried about this, guys, and you should be worried about it too. You know, we're heading to bankruptcy. Mr. Sherman, you live in a state that's already bankrupt. All right? You better than anyone know what this is going to be.
But we also know this. We know, and I know you say nobody wants to do nothing, but we do know this, that if nothing is done, by 2030, 1/3 of our gross domestic product will go.
Put me in charge. I'll do something
costs.
about it. Just if we
No,
can
no,
get
but
an
the
executive
Congressional Budget
order.
Office actually has projected, not badly, whether it was the Bush tax cuts or whether it is the past efforts in CHIP, Children's Health Code. Maybe it isn't right on the dime, but it has truly been inside of the running the bases there.
All right, I got to go, guys.
It's not done badly.
Bill,
We appreciate the debate. We appreciate the debate. It was very good. Thank you very much for helping us out tonight.